Hello, good morning everyone. Myself is Dr. Vaibhav Shah. I'm basically a board certified maxillofacial surgeon from Mumbai, India. I practices only on a face and only related to the cosmetic concerns as well as the facial feminization. So today I'm presenting a case of a facelift surgery. Already in a link, in a bio, I have attached the link where you can see the surgical procedure. But here, I would like to show you the final outcome, like after doing a surgery, what result one should expect. So this is a very young girl. It's not like she's a very old girl. When you see this picture, she looks absolutely fine and perfect. But when you see the other pictures of her before procedure, you will understand that she has lost the natural contour of the face. The primary reason for this is because of a dermal filler. Well, a dermal filler is one of the anti-aging injection which everybody is using nowadays. It's become very common. But I would like to present the case of a dermal filler abuse patient. Uh, no matter how good quality or best company filler you use, it tends to leave their original position and it may comes to the in a downward direction or towards the chin area, and actually it worsen up her aging. That is highly possible. So this patient, she's underwent derma filler for the cheekbones, and after 2 years now that filler is come down to the chin area, which you can see completely on the face. So because of that loss of a contour, patient is not looking, patient is not happy, and she is not looking anymore having a the very slim face. She wanted to go for the slim face. That was her requirement. Okay, now you can see the after pictures. This is just after 7 8 days to the surgery. We have also performed the blepharoplasty because the first sign of aging is always on the upper eyelid. So you can see the stitches on the upper eyelid. You can see now the patient is having a very prominent jawline. Also, she is having, the face, the cheek which was drooping down, it is come into the normal position. It is, in such kind of a patient it is very difficult because when you open up, when you do the smastectomy and everything, it is very difficult to differentiate between the flesh or the granulated tissues and the fillers. It all merges up to the one big lump. So one need to identify it, one need to remove the dermal filler which is come down, and then you have to go ahead. So also, I want you to have a look at the incision line, the suture line, because that is also one of the major concerns of the patient, that you know what about the sutures, will it be visible? If yes, then how much it will be visible? So you can see in this patient that the suture is barely visible. It is around the ears. Practically, after like 3 4 months, next to impossible that anybody makes out that there is a suture. But yes, there is a suture. Okay. uh, and it is a complete a surgical facelift. We have tightened up the smash also, and we have tried to give the natural contour to the facial. The facial contour, the cheekbone should be high, the chin should be prominent, there should not be any jowl or the sagging on the mid face or on the laughing line. So we have tried to give those. uh, and the blepharoplasty also we have done, as I told you. So this is the picture which is like after 7 8 days of a surgery. The healing process takes at least 3 to 4 weeks, but after 7 days 8 days of a surgery, one can remove the stitches. On a fifth or a sixth day, we remove the drains. We put two surgical drains on both the sides, just to make sure that the healing is a faster and there is no seroma or anything. So that is how it takes. Now, in this picture, I want you to observe, or compare two pictures. The one is before and one is just after 5 or 7 days to the surgery. You can easily make out in a profile pictures, there is a lump kind of a thing, and the natural contour is gone. Like the filler is come down to the lower part of the cheek. It should be on a higher part of the cheek. So this is what I want to show. And in the after pictures, that is not visible. It is gone to the not natural, the natural contouring is restored. So this is a classical example of the dermal filler abuse patient. Nowadays, rampantly dermal filler is being used. I understand that it is one of the great tool for the anti-aging, but the quality is also important. Who is injecting, that is also important. At which plane one is injecting, everything makes a huge difference. And sometimes with the best of the company and best of the hand, one can get such kind of a result. It is highly possible. So in this picture, we have put up an arrow also in a picture, so one can appreciate the difference between two, for the how the dermal filler acts on a long term. This patient is almost after a 2 year, and she was very upset, undoubtedly. So this is how one can correct it by doing a surgical facelift.